Hello and welcome everyone. This is the second video of RTI Health Advanced series discussing health equity and focusing on cultural humility. I am Jared Bullard, a senior research data scientist with RTI Health Advanced under the Strategic Evidence Generation umbrella.
Hi everyone, I am Françoise Jean-Louis. I am a senior consultant in population health, outcomes, and health equity at RTI Health Advanced.
Great. Today, we've spoken about the face of healthcare delivery. So now let's look forward to talking about ways we can retool the system, leading to better outcomes for all. So a question I have for you, Françoise, is I've seen it suggested that the practice of being patient-centered requires providers to negotiate between two worldviews, being the patient and the provider. So what do you think about that concept?
So the concept of cultural competence alludes to an understanding of facts about a specific race or an ethnic group to provide culturally sensitive care. When we think about cultural humility, it digs deeper into that concept, right? It enacts a commitment to developing ongoing knowledge about an ethnic group to provide tailored care based on a patient's unique cultural experience. By exhibiting traits of cultural humility, providers and organizations can work together to eliminate those unconscious biases that often exist in longstanding frameworks like our healthcare delivery system. Conscious and unconscious biases exist and can inadvertently lead to unjust treatment. So providers, they can work to engage in continuous self-reflective exercises to recognize any biases that they may have personally. Those biases need to be eliminated to deliver true, whole person, patient-centered care. From the patient perspective, providers can engage in meaningful conversations where they're actively listening to patients to better understand the patient experience. Providers bring great medical preparation and knowledge to the table, but beyond that, patients bring a lot of valuable insight as well from their own lived natural experiences. So patient-centered care is respectful and uses individual preferences, experiences, needs, and beliefs to guide medical decision-making in conjunction with the patient. Getting to the root of how a patient is thinking, how they're feeling and doing is key to serving patients in a patient-centric environment.
Yeah, I totally agree, Françoise. Patient-centeredness requires putting the patient at the forefront of how care is delivered. So it requires listening to the needs of the patient and coming up with these care plans that are both appropriate and attainable to the patient. Yes. So these patient goals that providers set for patients, they need to be sensitive to his or her lived experiences and culture, and it should be targeted to fit their needs. Now, in cases where patients are more at risk, it means that it might require allocating more resources to certain patients so that they can overcome those risks and get to more equitable care. But the goals must be aligned that are both culturally sensitive for the patient and attainable for the patient and within reach for the patient to reach those goals. So that way they can be more accountable to those goals that are set in place for them.
Absolutely, absolutely.
So a second question I have is, we've said culture can influence how individuals approach seeking healthcare. So how they are accountable for it and how they develop relationships with providers, etc. So how is culture represented among the 5 factors affecting health equity?
So culture plays a huge role in medical interactions, and it's intertwined in all of the determinant of health categories, to be quite honest. Cultural beliefs can influence how an individual consumes healthcare. It can influence how they feel about things like tests and procedures, blood draws, their preference in provider gender. It can influence how an individual approaches decision-making, their beliefs about disease states and treatment. From a cultural perspective, a lot of times we lean on our communities that we know and we trust to help direct us to arrive at the right decisions, seek care from someone who has a proven track record in supporting our community. On top of that, a lot of times communities seek healthcare providers who look like them, who are already aware of their cultural norms and their cultural needs. So organizations can do their part to help support their patients by making sure that their providers represent the community and are aware of some of the norms that are happening in their surrounding areas. Healthcare organizations are often the pillars of community. So having a presence in the community, partnering with faith-based organizations, community organizations, supporting the community beyond just providing medical care is key to build buy-in with the community at hand. When you think of things like the maternal health crisis, African American women are 4 times more likely to die during childbirth than their white counterparts. They are seeking providers who look like them, who have a proven track record of successful deliveries, and that are coming at high recommendations from their neighbors, their friends, their faith-based organizations from a safety factor. African American women have been known to be scared to deliver babies given the maternal health crisis. Identifying this as a cultural need and helping to support that community is key to developing trusting relationships to provide sound medical care.
Yeah, I totally agree. One thing I think is overlooked when it comes to cultural humility is one thing that you alluded to earlier on in the answer to the question is that it's interwoven in these factors of social determinants of health. For example, the food that's celebrated by a certain culture or a certain population of people, including how it's prepared and eaten, and that's woven into one's culture, and it can have impacts on outcomes, and also the social networks around people. So the people that are normally around others, if they are particularly around one group of people or one culture of people, they are not they're not around others and experiencing other cultures and other people. So those social networks and where we are brought up and how we are brought up and the people surrounding us is kind of interwoven into our culture. And all of that really does impact how we can experience these health outcomes. And it's going beyond this individual level to a more population-based level approach. And it's not at one specific point in time either. It's over the entire lifespan of one's life. Culture is built into us when we are born into our families, and it holds on to us throughout our entire life. So it's very important and interwoven throughout one's entire lifespan.
Absolutely.
So the third question I have for you is, what role does cultural humility play in advancing health equity among healthcare providers?
Yeah, Jared, embracing cultural humility, it's not a singular event. We can't check the box and say we are now, we have attained cultural humility.
Yeah.
Individuals change, communities change, populations change. Look at the impact that the COVID-19 pandemic has had on healthcare overall. It has shown a spotlight on how populations that are underserved or less advantaged than others, how they consume healthcare, and their healthcare needs are different from, various other areas where healthcare is robust and easily accessible. The healthcare landscape is continuously changing. That's where cultural humility comes in. By institutionalizing a partnership mindset with patients, providers are committed to learning from their patients about their cultures and how their culture affects them on an ongoing basis. If you look at certain demographic groups, COVID-19 had a huge impact, especially in the early days, on individuals who had type 2 diabetes. Certain demographic groups are more susceptible to have complications or are at greater risk to developing type 2 diabetes. So COVID-19 had a greater impact on those communities than others that don't have that same risk factor. As providers are able to gain a better understanding of patients' cultural needs, their concerns, and how it impacts their healthcare decisions, it creates a space for evolution of healthcare techniques, approaches, all within the care delivery system. And that's the shift that we're at today. These efforts help to provide care that is not only high in quality and culturally proficient, but it's equitable. Everyone is able to receive the same care and operate at their highest health.
Yeah, I totally agree. I love how the American Psychological Association put it when it described cultural humility. And they said that cultural humility opens doors to restoring or fixing power imbalances where none ought or shouldn't exist. And for example, in the historical approach to healthcare, there's always been a power imbalance, I think, between patient and provider, where the patient was the provider. But now, since the patients are a whole lot more informed, that power balance is shifting. And it's great that it is shifting. And there's other power imbalances that we see between races and ethnicities as well. And being culturally humble will start to break down those barriers and break down those imbalances that we see in power. Because we really have to get to a place where the patient and the provider and everyone else really is sharing power between each other. So each and every person is unique. They're bringing their own cultural and their own diversity and unique life experiences to the table. And we should all appreciate that diversity and uniqueness. So thank you everyone for joining us for the second video series for cultural humility on our discussion for health equity. And we hope to see you on our third video for the series.